Thank you, Lasky Hirlock. I'm very happy to welcome the Minister to the Chamber again today. And I just want to make a preliminary point about suicide. And I don't intend to talk about suicide in relation to Vision for Change, but I do think it has to be acknowledged that there are over 1,000 people dead by suicide in this country over the last 2 years. And I think it's something that every part of society in this chamber needs to take consideration of and devote an entire debate to this topic. The mental health services in relation to suicide, I think, are in tatters. There are, not alone do the mental health services in many cases have no response to suicide in the community. In a great number of cases, the mental health services are not even aware that they're occurring. I can say this because I'm a health service professional for a long time, and I'm very aware of this. But I'm very happy to have an opportunity to speak on the Vision for Change policy. And for too long, the mental health services have been seen as the poor cousin of the health services, and the levels of investment over the years in the mental health services have been little short of scandalous. In 1984, I started my career working in the mental health services in Cork. And at the time, and I suppose still today, when you become part of a system, it's very difficult sometimes to see what's wrong with it. At the time, there were over 1,000 patients in the hospital, and the conditions due to historic underinvestment and, I suppose, wider societal views towards mental illness were not good, and overcrowding, poorly maintained buildings and unstructured days for patients being the most serious part of the problem. But I can honestly say that the staff that I worked with were probably the most decent people that I ever came across. And they struggled daily in very poor conditions to ensure that the dignity of patients received the very highest priority. I've learned many lessons in that old institution, and I think that the most important lesson that I learned is that decency is probably the most important thing of all. 1984 also saw the publication of an important policy document. It was one of the first major documents published. It was called Planning for the Future, and it was heralded at the time as the greatest show in town. But it is rather unfortunate that 27 years later, the full recommendations of that report have yet to be implemented. Indeed, the lack of political will, Lasky Hirlock, and lack of investment ensured that the recommendations were implemented in just a piecemeal fashion. The institutions are now mostly closed, and good riddance to them, I think, but the promised community developments have remained rather underdeveloped. But it's scarcely believable that for some people in long-term care, they remain living in institutions 27 years after the publication of a report which was committed to closing these institutions down and developing community services. Some years ago, Lasky Hirlock, I had the opportunity to be involved in an international literature review on mental health policy documents. And we looked at a range of policies across a lot of different countries. And among the many that we examined, we found that the National Service Framework for Mental Health in the UK to offer a very, very good model indeed for service delivery. But without doubt, and I can say this absolutely honestly, that the policy framework outlined in a Vision for Change is without peer across Europe or the world in any documents that we've seen. And what particularly impressed me about a Vision for Change is the comprehensive views it offers to where our services should be, and the potential and opportunity we have to create a world-class model here in this country. And we know that Minister Lynch, driving change in this area, the prospects for delivering such a model are very bright indeed. And the creation of a Directorate for Mental Health, as announced by the Minister, is an excellent start, and the Minister is certainly to be commended in this. A statement of specific interest in a Vision for Change, and I'll read it, is the vision that guides this policy requires mental health services be characterised by a partnership between stakeholders. And this is an ambitious statement of intent and requires a complete cultural shift in how we deliver our services. In the past, services were characterised, and they still are, I think, characterised by a paternalistic approach where healthcare professionals are seen to deliver healthcare to the service users. And we've seen just media reports just this very day of how a 40-year-old man, an involuntary patient in Naas, and his family are seeking to stop the services from administering ECT to him against his will. And while I fully understand the complexity surrounding this area, I think it's an indictment on us as a society. In any other branch of medicine, or indeed any other branch of life, a major invasive procedure would not be sanctioned by law. And the law in this instance is Section 59B of the Mental Health Act, and the requirement is that 2 consultants are needed to form an opinion that this is necessary, and then we can administer ECT. I think in every other branch of medicine, issues of this import would require a court order for such a thing. So the Minister referred in her speech to seeing the health services as seamless, and the rights of patients in one branch of medicine should be the same as rights of patients in another branch of medicine. And I think in the mental health services, with relation to this case, as an illustration, we have still a long way to go on this. But as well as a cultural shift, the other challenge facing visual change is cost. And the level of change envisaged involves significant investment indeed. And it is clear that adequate budgetary plans should run parallel with policy change, and I'm worried about this in this instance. The challenging financial situation facing us does not bode well for this change, and I note that money will be raised by land sales and ring-fenced for investment in the mental health services. But to be realistically, can we really say with hand on heart that any of us believe that this money will be realised from this source in the current economic climate? I think that the government should front-load the costs here and recoup its investment later on when the land sales are achieved. But in tandem with policy changes in mental health services, I think we must also affect policy change in other areas as well. And we know that poverty and social exclusion are related to mental ill health, although the exact pathway remains unclear. We know that 70% of service users are dependent on welfare payments. So obviously, policy needs to recognise this. I'll be well finished in 2 minutes. We know that access to housing is a very important element in recovery and the maintenance of good health. And I know this from working in the area where we can see people being discharged from hospital having no place to go, and it really remains a very significant obstacle to allow people back to live in their communities where they want to live in quality good housing. And I think that we must build partnerships between the mental health services and local authorities in this area as well. Education policy, of course, is vital, and education policy has to recognise the important role it has to play here. It should be a requirement for stigma measures, for instance, to be included in any policy with regard to education. And while I recognise the importance of a vision for change and the Minister's undoubted commitment, I think we need to also recognise that policy change in other areas need to be achieved before we can actually deliver the exciting prospects that are outlined in Vision for Change. Thank you.